Now, ladies and gentlemen, infertility is a deeply personal and often painful journey of affecting couples emotionally, socially, and sometimes financially. In Ghana, where cultural expectations around marriage and children are high, the pressure can be overwhelming, especially for women who often carry the heavier burden of blame. But medical advances such as in vitro fertilization, IVF, are changing the story, offering hope to many families who long to conceive. On the afternoon show today, we sit down openly to openly discuss the realities of infertility and the possibilities that IVF brings. Together, we'll break the silence around this often taboo topic, explore the myths and misconceptions, and understand the emotional and financial demands of this journey. And joining us right now to have that conversation is Whitney Wachi Mensah. I want to compare that to dance. DJ Phil, but all righty, right. Whitney, DJ Phil, where's my music? Whitney, welcome. Please, have a seat. DJ Phil, thank you very much. Thank you. Also, we have Dr. Erica and Tiama Mensah joining us for this conversation. Dr. Erica, are you going to dance? Or are you walking like with me? Thank you. Ladies, welcome. Thank you. All right, because this topic is quite sensitive, I want to, ease up things a little bit. So I'm going to ask, what's your all-time favorite classic Ghanaian music? Wow.
I like Riela's rendition of "We're Going."
Oh.
That has a lot of power to it. All respect to the original, but I think Riela's rendition.
All time.
Yeah.
All time. Yeah. Wow. I didn't see that coming. Dr. Erica?
Okay, I don't know if you know this one, but it's an old classic song. It's called Bonre Kinti. I like
is it
that
from
one.
that?
No, I think it's Ephraim Amuwa. Very old.
Oh, the very, very,
Very
old one.
But
I see.
I liked it too.
Well, thank you very much for joining us, ladies. Let's get into in vitro fertilization, IVF. I guess the first question would be, for the many people who don't know what IVF is, especially for the men like me, what is IVF? Dr. Erica?
All right, so IVF is in vitro fertilization. And to make it very simple for everyone to understand, it's the process of, let's say, forming a baby, okay, or making an embryo outside the human body and then implanting it into the human body. So basically, the fertilization that was supposed to occur in the woman, the egg and the sperm, they're fertilized outside, and then it's implanted in the woman. So that's just the basic understanding of it, yes.
Okay, and who is it for? Is it for women who only can't conceive, or are there other conditions that require IVF?
All right, so there are several reasons why a couple may opt for IVF. There may be a partnered couple that are struggling with infertility. There may be a woman who doesn't necessarily have a partner or a spouse and is going for a donor. There may be surrogate conditions. There are so many conditions in which someone may opt for that. So I don't think it's fair to only tag it as it's something for women or something for a woman struggling with infertility. There are several reasons why someone may opt for in vitro fertilization. We are in a modern world now, so
Indeed.
yes.
But what's your knowledge on IVF, Dr. Whitney? Hey, did I say Dr. Whitney? Whitney.
I think Doc has said the majority of things, but for what we do, so we're a community. I got to know that we are the first community in Ghana that is basically a safe haven and space for couple and women who are dealing with the stigma of infertility, miscarriages, and stillbirth. And what we try to do is intervention for couples who, under normal circumstances, they've tried and tried and tried, and they are financially challenged. So we team up with Doc and her people, and we are literally asking for discounts on services like that. So that we do that because we realize that in the quest for that, a lot of couples go to places they are not supposed to go to, and some end up dying, some end up losing their wombs, some end up taking things they are not supposed to take. So for us, interventions like IVF, surrogacy is a very good step, especially in our society, because we may say that Ghana is very enlightened, but when it comes to issues of birth, pregnancies and all, we're still very backwards. And we try to do a lot of education around this. So for us, this is a very good intervention.
Indeed. Let me come back to you, Doctor.
Yes,
Understanding this more, what causes infertility? Why can some women conceive and some women not be able to conceive?
Okay. Now, when we're talking about infertility, that is the inability of a couple to conceive after trying for a year. So trying regularly and consistently for a year without using any contraceptive methods. Now, when we talk about infertility again, you said why some women find it difficult. So I wouldn't say women. Some studies show that about 33% of infertility is from women, another 33% from men, another 33% from both the woman and the man, and then another 33% we do not know the cause of it. Okay. So we have female and male causes of infertility. It's not about
just
women.
about women.
Exactly. So for both the male and the female causes of infertility, it's from top to bottom. So from the brain, that the brain is supposed to release some signals to act on the ovaries or the testes to produce certain hormones. If there's a problem with that, you can have infertility. It can be structural, maybe a structural uterine problem. You can have fibroids that are so big and they are blocking the uterine cavity. You can have issues with fallopian tubes. You can have issues with ovulation from the ovary itself. With the male as well, he may find it difficult, or the hormones may not act properly to be able to produce the sperms and all those kind of things, yes. And then he may also produce the sperms, but then it may be abnormal. He may produce normal sperms, but then there can be an obstruction so that it would not come out appropriately. Or he can produce sperms, and then these sperms would not be as functional as we would want it to be. So there are several causes, but it's not attributed to woman or a man alone.
Right.
So we say an infertile couple. It's not the man, it's not the woman.
Person. It's always a couple?
Yes.
Because
Not that it's always a couple. It
anyways.
takes two people to conceive. So we don't look at just the man or look at just the woman, okay, because there are several causes. So infertility is always tagged on women, but I just want us to understand that it's not a female problem. It can be any of us.
It's important that you had to reiterate that. Very, very important. Are there risk factors?
Yes, there are certain risk factors. So you can be born with certain conditions that can render a person infertile. Like I said, you can have some structural abnormalities and all of that. But in our part of the world, one major thing that we have to look at is infections in the females, ascending infections. So you can have a sexually transmitted infection or post-abortion infection, post-delivery infection, and this climbs up the female cavity. So it climbs up, enters the uterus, the fallopian tubes. It can cause scarring and all those things. So those are some of the important things that we have to note in preventing infertility. Those are some of the things we can do to prevent it. So these are some of the risk factors as well.
Whitney, because you help a lot of women, especially also in this area, what are some misconceptions or myths you've heard surrounding infertility and the process of IVF? We'll get into IVF shortly. But what are some of the things you've heard, some of the weirdest stories, if you don't mind sharing any with us?
So one of the major things that we realized was that because of how our society is, even when a woman knows that I probably have an incompetent cervix, they still want to carry.
Yes.
Incompetent?
Cervix.
Oh, okay.
They still want to carry because we place so much emphasis on you carried that child. So that child is your child.
Yours.
So when you're even offering the options that are available, because one of the things we make it very clear with my dear sister Skipper is that it is not just a matter of you're carrying a pregnancy. There are other options that you can look at. And at the end of the day, it's your child. But they come with a mindset that I have to carry. If I don't carry, society would not accept that that is my child. That is the biggest misconception. The other bit is the fact that for a lot of, especially the couples, they have anxiety of, will I bond with the child, since I am not the one carrying the child. And we let them know, yes, you will bond with that child. It is only somebody keeping the pregnancy and the baby safe until delivery for you. Everything else that comes, for if all things work out well for you, is his sperm, is your eggs that they are in producing. But it is just somebody carrying, because under the circumstances are not normal for you to carry. Even if you're using donor sperm, it is still your child. It is your bond with that child. Our society is so embedded in the fact that the only way somebody, even adoption, there even a lot of skepticism around that. But gradually with education, we are making headway there for people to know that, listen, this is such a good intervention for people who have tried, and sometimes is at their health risk. And we are trying to get them that joy. So people need to ease up. Sadly, with over 7 years of what we do, we realize that a lot of the talk sometimes even comes from women. So we try to do that education first with the mothers-in-law, the mothers, the sisters-in-law, to get them to understand that it is still a child that this person has. It is still your nephew, your niece, your grandson, your granddaughter, and there's absolutely nothing wrong with this intervention for them. It is such a miracle intervention that we all need to embrace it. But our society is still a little bit reserved about that.
Doctor keeps nodding her head. Do you agree to what?
Yes,
Whitney's
I
saying?
agree with what she's saying wholeheartedly. Our society or our culture is a pronatal one, meaning that we want to give birth, we want to carry our own. And there's a lot of stigma against the woman who is not able to carry her child to term or even able to get pregnant. As we mentioned earlier, it's not just about the woman. There are also male factors of infertility, but women often carry the shame. And it doesn't mean that men are not affected and they do not carry the shame too. Because in our culture, if a man doesn't have a child, sometimes someone will ask, is there something wrong with the person? It's something common that if a man reaches a certain age and they say he has no children, everybody starts to question why. So it's something that we care about. We have a lot of children. We want to carry our own children. Once someone gets married and it's a few years, everybody's wondering what's going on. We start asking questions. And even in my reading to come for this program, I learned that in certain cultures, I'm sure maybe in the past, if you do not have children of your own, you are not even given a befitting burial. Women who are older and didn't have or carry children of their own are sometimes tagged as witches. So it's a lot.
Wow.
Yes.
You are not even sometimes, if you're a man, council of elders, you are not.
Yes, you're not
Called to
invited.
Called, yes,
Exactly.
because they don't see what you bring to the table.
Today, as we speak.
Yeah, in some cultures,
in some
they still do.
cultures, yes. And interestingly, another thing I came across was that you can have children, but then if you do not have a male child, sometimes
Yes.
you are still regarded as not having children.
That in many cultures.
Yes,
even all
in
around
many
the world.
cultures, yeah.
Yeah. Okay, then let's go through the process of IVF.
Okay.
For those who have this mentality, perhaps you can help us with this education, what the process is like, and why a woman or a man shouldn't think that it's not their baby if it didn't come directly from the woman's womb or didn't conceive by herself.
Okay. All right. Now with IVF, I'll try and make it as simple as possible, not using any technical terms. If a couple is struggling to get pregnant, they first go and see the doctor, preferably a gynecologist.
Okay.
They take history, they examine you, they assess you, and if they're able to find out the reason for the infertility, and it's something that can be managed or treated, they first attempt that. But then if it's something that they believe that in vitro fertilization will be the best way to go, they go that route. After the history examination and all of that, they would counsel the couple, because IVF is not a sure way of conceiving. Okay, there are
And
failure
very
rates as
expensive.
well. Yes, it's expensive.
We'll come to that.
It can fail. You can undergo many cycles, and there are so many factors as well. So they counsel you. In certain organizations, they even counsel you with a clinical psychologist. Now, after that, they give the woman medication so that she produces a lot of eggs, okay, because they want to harvest these eggs. And then they take the man's semen as well and isolate the sperm from it. Now, the fertilization, why we call it in vitro, is that the fertilization happens outside the human body. So I get your egg, I get your sperm, and then we fertilize it outside the human body.
That's the only difference here.
Yes.
Is it?
So, I mean, you would have had normal coitus, gotten
Yes.
pregnant, and then proceeded with carrying your child. But for this, we take what we would have gotten from coitus, put it together, and then wait a number of days, do some tests, see which ones are viable, and then implant it in the woman. Okay, and then we also wait some days to make sure that the pregnancy has taken up. You get a positive pregnancy test, and then they give you some medication to help the body hold the pregnancy. And from then, I mean, it can be a normal pregnancy. It has its risk factors, but I mean, pregnancy is not without risk. So you carry your pregnancy, and hopefully you're able to carry it to term. You have your baby, and it is yours. Now, there can also be surrogacy. Sometimes the female may not have the structural ability to carry the pregnancy to term. So if you have enough resources and you're in a place where surrogacy is permitted, all this fertilization that goes on, it wouldn't be implanted in the woman's body, but in another or a carrier's body. They can also have the cases where maybe the woman is having an ovarian failure, or we are not able to get the desirable eggs that we want from her. So they can have a donor egg, you can have a donor sperm, and then follow the same process as we outlined. So it is still your child, maybe not genetically, or maybe it wasn't fertilized inside you. But I believe that motherhood, fatherhood, and parenting is not only biological. So we have to embrace it and know that right now we're at a point where infertility is not as it used to be in the olden days, and there are interventions, and there are several ways to go about it. Yes.
What is the success rate for IVF? If you know globally, you know the success rate for
Okay,
IVF?
so in my reading, it's not a standard success rate, but it's per the age. So the age of the woman and the number of cycles that you have done, they determine the success rate. So it's about a 50 to 60% success rate. But the younger the woman is,
The better.
the better.
Better.
Yes,
Okay.
and then the more cycles you've done, there's a higher chance of you having a pregnancy carried to term with the more cycles that you've done as well, or a successful IVF outcome. Yes.
And averagely, how long does the process take?
Averagely, so as I said, it starts with your history, your examination, all of that. So it can even take you about a whole year. Yeah,
It's a whole year.
To
Give
prep
yourself a year
yourself,
to
give
prep
yourself
yourself.
time, gather your funds, take medication, do this, do
The
that,
shots and
the
all
shots,
that.
all of that. So it's not a quick time thing. It's something that you have to have the time, have the money, pace yourself. And I mean, pregnancy itself is 9 months. So imagine, everything takes time.
It takes a while.
Yes,
Yeah.
it takes a while.
And what do you know the emotional and psychological impact this has on a lot of women, especially for those who go through the process and are still not able to? Come on.
Number one.
You're one?
Yeah.
Wow.
I'm sure by now a lot of people know my story, and even the reason why we started My Dear Sister's Keeper, because I went through 7 miscarriages and 2 stillbirths
Oh,
before
so sorry.
my boys came. So it's for us, that's why we do this. It's a group of people who have been there and know how lonely this journey can be. So we've come together for other people not to walk that lonely journey alone. And I can tell you for a fact that apart from the fact that these medications are no walk in the park, even as a couple, you need to be in a place where you are together against the world, because it gets to a point that even your cycles change. And you realize that there's some days you realize that coitus is just for the purpose of, I have done the shot, I am fertile in this window, so let's get it done and see what happens. The fact that you put on weight, because those are hormones that are you're injecting into your body. you're going to deal with all the hormones, all the emotions you go through. The fact that it is not guaranteed that if I go through the cycle, the eggs will take or they will not take. So for us, what we even do prior to they seeing the doctors is we have a whole counseling and psychology team that preps you before you start the journey, because you need to be in that space for anything that will come. Because even normal pregnancies, like I say, I'm saying I've had 7 miscarriages, and they're normal pregnancies that I lost. So imagine the added, I have spent all this money and then it didn't take. And I need to go back, gather it again,
funds.
and start all over. So we usually, when people are shocked when they reach out, oh, I want to join the community, and they realize that I'm literally the last person you deal with when it comes to that. I'm just the face because it's my baby. But you go through the counseling first. You go through the cycle because you need to be in that headspace for what you're about to go through. So it is no walk in the park, but for a lot of people too, it's being that miracle that they needed, and they have their babies.
I don't know what your support system was like when you were going through it, but I like to ask both of you how important the role of any partner at all in this process, because the woman is going to carry the child anyway. So how important is the other person's role in ensuring success? I know they are not doctors, they are not medical people, but do you think there are roles that partners, maybe friends, families could play to help any woman who's going through this process? Please think about it.
It's extremely important. For a lot of people, your first support should be, that is if you're married or if you have a partner, should be the partner you're doing this with. It is easier when the two of you are on the same page against the world than you have all the pressures and you're fighting each other. Trust me, no egg wants to fertilize in an atmosphere where there's a lot of anxiety and all that. So it is very important that the two of you are on the same page. When it comes to your friends, family, and loved ones, I have come to realize that it's important to sit people down and have this uncomfortable conversations. So my partner and I are going through this. We do not need for you to ask some unnecessary questions, especially directed at the woman. Because we are in a society that, for some funny reason, everything to do, like Doc said, everything to do with infertility is always the woman. And the woman is just a receiver to carry. We assume that the fact that a man can ejaculate, if the fact that a man has a hard-on to have coitus, then that means that they are very fertile. And sometimes that is not the case. But we lay it at the woman's door. So we always tell the married couples that come that make sure that the people around you, they know that you're in this together. There are things they cannot say to your partner. There are questions they cannot ask. And if they have any concerns, because sometimes so you can be out of concern, especially for the mothers, they should ask themselves, what if it was me? How would I want this being asked? It's a concern because for a lot of mothers, it's past 9 months after wedding. She's going to women's fellowship meeting. All her other friends now come with their grandbabies, and she feels like she's being left out. So sometimes it's out of concern, but sometimes the concern becomes a bit obsessive, and there need to be a little empathy on both sides. So if you're somebody who has a friend going through that, I can tell you for a fact, walking down that road, that there are days when the last thing you feel like doing is even talking to anybody. The last thing you feel like doing is explaining your situation because you know what you're going through. And we should understand that. The best you can do is just to pray from afar and love them from afar. Or when you're even with them, just sit with them. That's also giving them support.
Do you think the church has a role in helping with this education?
Oh, yes.
And faith organizations, not just the church, maybe in Islam as well. they have a role to play?
Yes.
Do you think so?
We are actually now advocating for, when you're about to get married, they ask that you do all these tests in the church. We actually now, when we have speaking opportunities, we actually put it officially to them that we would be very happy if fertility tests is added to all this testing that is done, so that the couple even know if they are compatible. They know, the men know if all the soldiers are ready for battle.
Is it a new thing in the church?
It's a
Something
new
we're
thing.
introducing now?
Yes,
Or
it's
they
a
already
new
do
thing.
these tests?
No, they don't.
They
They
tell not
don't.
to sleep before.
Yes,
Not to.
they don't. But we are asking for this because one of the things is also that sometimes couples are not compatible to even have babies, and then they go their separate ways, and everybody goes to have their child. It's one of the unexplained things in life. So we are asking for this test to be done. Let the men go and do a semen analysis. It's very important that they do this, and it helps.
So outside of the church, any man also can just walk into any
Oh, yes, you
clinic
can. You
and
can walk
just,
into a lab, into a
that
clinic
helps.
and do that. Yes, it's possible. If you need to know, you can do it.
Interesting.
Yeah.
Well, this is very, very educative for me, honestly. I am taking a lot from this. How expensive is this process?
Okay.
I know you say it's relative, but how expensive?
It is relative, but I would say that anything from $5,000 upwards.
Five
Yeah,
Yes.
that's your starting price.
Yes.
for the IVF process?
Yeah,
Yes.
Throughout the process? Or
starting price.
Starting. Yeah.
right now, the CDCF is how much? It's 11. I wanted to do a calculation to see.
So that's about 60,000 plus.
So that's like
Yeah.
60,000
Yeah.
starting point
Yeah,
to conceive.
yeah.
Interesting. Well, like we said, share your comments on our WhatsApp number 0266-283-881, 0266-283-881. Anita is standing by to tell us what you're asking us or saying.
Yeah, and so we have some comments coming in, and this one says, great topic for the day, TV3. IVF has been a huge problem for couples. Thanks for the update. You're doing great, Gordon and Anita. All right, thank you very much. This one says, I broke my TV remote and wasn't bothered because my channel is on TV3. That's how much I love you guys. Okay. Kwejo Dakwa Dai from Tamale says, good day, TV3 and your guest for today. I wanted to find out if surrogacy is ideal in our African setting. Okay. Whitney and our doctor are definitely going to tackle that for you. And this one says, good afternoon, Anita. Please, will IVF be successful if I have PCOS? Okay. This one says, how is it possible for a man who can't... okay, let me find that one. Okay. Okay, someone is also asking how much IVF costs. Well, I think that has been answered already. And this one says, how is it possible for a man who can't father a child go through an IVF procedure without, with you, the wife? Is it possible? Okay, okay. This one says, good afternoon, TV3. Please, after going through the whole process, are they going to do an operation to put the embryos in the woman's uterus? Okay, okay, that will be answered for you as well. And does it mean you're not fertile and won't get pregnant when you have sex and the sperms doesn't come out? Okay, I really don't know what you're trying to say with that one. But okay, this one says, good afternoon, please. I'm called Sammy, and my problem is low sperm count that I and my partner have tried for a long time without solution. Please, any assistance for us? Okay. This one says, please, I want to ask again that I have PCOS and I have taken several supplements, but I still cannot conceive. What can I do again? Okay, dear doctor, I recently underwent an MRI scan and the result indicates a right-sided pituitary gland hypointense lesion suggestive of a microadenoma. I hope I got that correct, by the way. I have also been experiencing irregular menstruation, and as someone looking forward to conception, I would like to kindly ask, what steps should I take next in terms of treatment or hormones as well? And what are my chances of, fertility or preparing for IVF? I mean, can she improve her chances? I'll be grateful if your guidance on this to help this condition, and also if it will affect my fertility journey and the recommended course of action.
That's a whole letter to the
That's
doctor.
a whole letter.
Yeah, it's a whole lot. I don't know if we can tackle some of them now.
Maybe we can.
Yeah, I think we should.
There's the PCOS one.
Yeah, okay, well, let me take the final one. It says, Ahmedi Bless in Accra, with respect to surrogacy, would the carrier of the baby not have any part of the carrier's DNA? Also, what are the likely effects of surrogacy as well? Is it on the mother or the child or, okay.
Yes. Are you going to start from the last question?
That's a mouthful. I wouldn't even be able to remember all of them.
Okay, surrogacy.
There's the one about surrogacy,
Yes.
whether the carrier doesn't have any contribution.
The person is just an incubator for your baby. So whatever needs to be formed has already been formed, and they're just carrying that for you. The part about our side of the world and surrogacy, I think people don't even realize that it's been with us long before it became something that now people look at as an option, because there are times when siblings even carry for the other sibling when they have health issues. This happens a lot. People, I've heard of mothers and read articles on mothers who are still quite young and they carry for their daughters when the daughters have extreme cases of PCOS. The thing about PCOS is, by the time a lot of women realize they have PCOS, they're getting into the advanced stages, because most people, and it's quite sad, because of all the conditions that come with our menses and all that, when you're not getting your menses, it becomes a party for most people. They are happy, not realizing that it's actually a problem, because as a woman of a certain age, you're supposed to menstruate every month. So if you do not have a flow every month, it should be something you should be alarmed about. If you have just one day and it stops, it should be something you should be alarmed about. It's something that it's coming up quite a lot, where a lot of women are having the symptoms of PCOS, but are not aware until they get to a place where they want to start trying for a baby, and then they realize that, oh, I'm dealing with this. So we ask that it is okay for you to walk into a hospital and tell the doctor, just like I do testing, you do testing for any other, you do BP, your sugar level and all that. I am at this age and I want to do that testing, and it should be done for you.
Interesting. Well, Doc, from your medical perspective, can it be successful with someone going through PCOS?
Yes. So now with PCOS, you have to first ascertain the reason why the person isn't conceiving. Is that the person is not ovulating or something like that. So the IVF bypasses all these parameters. They are not waiting for you to ovulate on your own, have sex on your own, for implantation to happen, or for the embryo to be formed on your own, right? All of this is done and then it's inseminated. So it is something that is possible. Someone with PCOS shouldn't say that because I have PCOS, IVF would not go for me. Go to the hospital, see the doctor, let them go through the entire process, and then it can be done. It is done.
I want to be a doctor and answer this question, but someone is asking if with the low sperm count they can do IVF.
You can do IVF, yes. Now, as with my explanation earlier, when the semen is taken, the sperm is isolated. So even if you do not have so many, you need just one.
Okay.
So it's isolated, one with good morphology, and that one that swims well, has good characteristics, is taken, and then is fertilized with the egg. So even if you do not have plenty, and you have just small number, we can use it for something.
It's the quality that matters.
It's the quality
You can see the
that
mischief
matters.
on my face. Right?
I can see that.
And I want to ask for a friend who is
Okay.
whispering in my ear.
That's fine.
Since we are having this infertility and IVF conversation, what advice would you give to the men? Since the focus has been on women all those while, what advice would you give to the men to help them improve fertility? That's one. And are more men coming to the IVF conversation table?
Yeah.
Yes.
We usually have a free walking clinic every quarter. And for the first time in 7 years, when we had the first one this year in February, we had 70% men walking in. The sad bit is that they walk in when they are age 40, 50, and they realize that where it is hitting, I now need to find a solution. But men need to accept that infertility is not just a woman's thing. The man is equally affected. For a lot of men too who like mixing a lot of shots and drinks and this, why your face changed all of a sudden?
Not me, though. I'm thinking about the men you're talking about.
Yes. This has also proven to be a factor that affects fertility.
Wow.
Yes.
Shots.
You're mixing this
Alcohol.
alcohol, mixing this alcohol. This makes you go on a longer journey when you have coitus and all that. Masa, it's your own immune you're dealing with. Please seek the help that there is than being a self-serving quack doctor to yourself. It's very important.
That's a nice term.
And there's no shame in, like Doc saying, walk into a facility and go get checked. I mean, go and let them check, let them do the analysis for you so that you know that, okay, the soldiers I'm working with, they can do the work they're supposed to do.
Okay. Doc, you want to add your
Yes.
medical expertise to it?
Yeah, so what I would like to add to it is that men, unlike women, may not necessarily see factors or indicators or red flags of infertility. You know, a woman may have very painful menstruation, she may not have her periods regularly, all those things. So they can point her to the fact that something wrong is going on. A man may not have that, but it doesn't mean that they may not be the contributing factor for the infertility that is going on. And I think generally lifestyle changes are also important, that you should eat well, minimize your alcohol, exercise, don't smoke. All these things scientifically have been shown to improve fertility. There's also this thing about not wearing too much of tight clothing and allowing room temperature air around.
Talk to my people for me. Right?
Yes.
Wearing free clothes, right?
Wearing free clothes.
Boxers,
Yes.
that's a very...
In as much as statistics do not show that if you have infertility and you do this, it would increase the chances of being fertile. If you're normal and you have no issues, I think that you shouldn't rather create issues for yourself. Yes. So these are some of the things. And then they should also be very kind when they are having infertility with their partners, knowing that it may not just be the woman's fault, but it could be both of you, it could be you, or it could be unexplained.
Indeed. All right, and that very long question that came in, we'd like you to address it. Dear doctor, I recently underwent an MRI scan and the result indicates a right-sided pituitary or pituitary gland hypointense lesion, right? Suggestive of a microadenoma. I have also been experiencing irregular menstruation. As someone I'm looking forward to conception, I would like to kindly ask, what steps should I take in terms of treatment or hormone evaluation to improve my chances of fertility or prepare for IVF? Okay, I'll be grateful, she says.
Okay. Now, the pituitary. Earlier, when I was speaking, I said that the causes of infertility, we should go from head to toe. So in the brain, that's where the pituitary gland sits. And it's a gland that produces hormones. These hormones go and act on the ovaries or the testicles, and then they produce the hormones that used to regulate fertility. So now when this pituitary gland is having issues, of course, it can affect the signaling for you to produce the hormones that are used for your ovulation, menstruation, fertility, and all these kind of things. So I understand why she's saying she's having irregular periods. And I'm sure even as she sent these results to the doctor, they would explain to her that that is the seat of hormone production. So it's a problem that she may have. Okay, she would have to see a gynecologist and a doctor that deals with hormones, the endocrinologist as well, for them to set up a multidisciplinary team and then work to see if, work on her to see the way they can go forward if she's thinking about conception. Yes, that's how I would say it. I'm not going to go into details on TV, but she does have to see a physician and she has to see a gynecologist. Yes.
Whew. What an insightful session with you too. And what would be your final words, maybe advice to a couple going through infertility briefly?
Okay. All right. So I think I'll be very brief about it, that infertility is not a woman's fault. As in training to be a gynecologist, I see a lot of women, and a lot of women blame themselves for this. So infertility is not necessarily a woman's fault. In fact, the word fault should not be used. And there is hope for someone who is struggling, or for a couple struggling with infertility. And I also like to add that parenting, or being a mother or a father, is not just a matter of biology, but there are so many factors, or in so many ways you can be a parent. It's not just about fathering, mothering, and pushing out. Thank you.
Thank you, Dr. Erica. Whitney?
We always have this that we see on the community platform, that however parenthood comes to you, it is a miracle. So you need to grab all the opportunities that there are now that in the past there were not. Because however it comes to you, that's a miracle that you're experiencing.
However it comes to you, that's the miracle you experience. By coming in from Whitney Boachi-Mensah, managing partner. I didn't do this in the beginning. Innovations Events, WBM, and founder of My Dear Sisters Keepers GH, and co-executive producer, of course, the Music Women's Branch, Ghana's Rep, ECOWAS, ECOFES, and also Dr. Erica Ntiama-Mensah, obstetrics and gynecology resident. Ladies, thank you so much.
Thank you.
This was very, very good for me. All right, you're still watching the afternoon show. Heading over to DJ Phil for some feel-good moments.